I'm Miriam. We're at Pasadena Eye Center, and we're going to talk to Dr. Ryczek about routine vision care. Well, living in Florida, we're outdoors a lot. So what should I do to protect my vision?
Okay, several things. First of all, a good wide brim hat is a good idea. Not only protects the eyes and the eyelids and the top of the ears, gives you enough shade for the eyes as well. I also definitely recommend sunglasses with ultraviolet protection. Also, I like people to have a good nutritional background as far as their diet. Diet and exercise are important for our eye health in general. So when you go to the Gator game, wear your Gator hat, come cheering, but also make sure it's a nice wide brim hat and you have your sunglasses on.
Great. What kind of things should I eat to make my vision good?
A good balanced diet is best. Diet and exercise is very important. Good balanced diet with plenty of fresh fruits and vegetables. Many of us eye doctors are recommending dark leafy greens in your diet, especially spinach, broccoli, kale, and collards. Those are the big four.
How does the team approach at Pasadena Eye Center benefit patients?
All the eye doctors here are very good at what they do. Each of us can take care of most anything any patient's going to need, but we do interact together about quite a few cases on a daily basis. So we each bring our strengths for each patient. And if there is ever a question or concern about a patient's case, we will get together and brainstorm it and come up for the best result for the patient.
When would specialty contact lenses be needed?
We have our regular general contact lenses, which can take care of most patients' visual needs. If a patient is post-refractive surgery, or they have a corneal scar or any warpage to their cornea, or in some dry eye cases, those are all good indicators for a patient needing a specialty contact lens.
How do scleral lenses help patients with keratoconus?
So in keratoconus, you have a very warped cornea. Think of the windshield possibly on your car being very warpy, okay? A regular soft lens will transmit that corneal warpage through their vision, and they'll still be very fuzzy. A traditional hard lens honestly won't give them the fit or the comfort to be able to wear them typically, and will pop out a lot. So we go to a scleral lens, which is basically a very high breathing, what we call rigid gas permeable contact lens. It fits actually on the white of the eye, the sclera, and vaults over the cornea, so it really doesn't touch the cornea. There is a layer of saline in between the cornea and the contact lens to keep the cornea healthy and happy, and the hardness of the contact lens makes basically a new cornea surface, so it gets rid of the warpage, if you will, to help the person see well, and they are traditionally very comfortable.
What does the fitting process look like for a specialty lens, and how is it different than regular contact lenses?
Specialty contact lenses, especially if you're talking scleral or some of the astigmatism multifocal lenses, they're a very highly technical lens. They have many more curves to them. They have to be fit very precisely. So we would probably do several extra tests as far as measuring the cornea, measuring the sclera, measuring their vision, if you will. And then we have to do a precise fitting with those. So there's more to it. It takes a little bit longer time. But here at Pasadena Eye Center, we've done a lot of them, and we're pretty proficient in the process. So we generally can get the patients taken care of just fine. Probably doesn't take much more time than a regular fitting as far as that goes.
How does the team approach at Pasadena Eye Center help complex cases?
All the docs are very proficient here. We all have our areas of expertise as far as that goes, and we many times will come together and discuss after hours certain cases that may need a little extra, or maybe as a second opinion. We'll run the numbers, we'll run the case, we'll run the circumstances together and decide what's going to be the best outcome for the patient. In all honesty, we practice very similarly. We have very similar outcomes when it comes to what we would typically do for a current patient, but it's nice to have multiple doctors that get along very well, have the patient's best interests at heart, and come to a conclusion that's going to be best for the patient.
Why is it valuable to have patients have all their eye care in one place, like their routine care and their medical care?
When we take care of patients for the routine care, we try to make sure, of course, that their eyes are nice and healthy and that they can see as well as they can. If they need further care, it's just a seamless transition from one doc to the next. We can speak about the patient's case, we know their history, we figure out what's going to be best for that patient. The doctors will talk between each other to make sure we have the best outcome for the patients. And in general, I think you'll find that most of our patients are very happy with that and very pleased that they can have all their service at one place.
What role do you play in helping patients after cataract surgery?
I do a lot of the post-op visits for patients. So I will generally see them at the 1 week mark after surgery. By then, the eye is generally pretty quiet and pretty happy. I make sure they're seeing well. I look inside the eye, make sure everything is exactly as we expect. I will take care of any patient concerns as far as answering questions. I will look inside the eye, make sure that it's nice and quiet as we expect it to be, and I will dose the medications accordingly to help them have a nice smooth transition through their phase to healing.
What kind of follow-up care should patients expect after cataract surgery?
Okay, so generally you have your day of surgery, and then you have your 1 day post-op visit, and then your 1 week post-op visit, and then your 1 month post-op visit. Those all are fairly quick. Dr. Emery does an excellent job on his patients, so he makes my job easier. We just see really, really good results. So those visits are generally pretty quick, pretty easy. Patients are generally very happy.
What would you say to a patient who's nervous about their post-op care after cataract surgery?
That's a great question. Most of my patients, prior to the first cataract surgery, are very scared because ultimately we're working on their eyes. And many people are very conscious and scared of anything happening with their eyes. They have their first eye done. When I see them at the first post-op visit, what I generally hear is, number one, I can't believe I waited so long. I should have done this sooner. And number two, they can't wait to have the second eye done. The reasons being, number one, our surgical staff, especially Dr. Emery, but also the coordinating staff, help to make sure that the patients have a nice, seamless, low-stress environment. They have a very good outcome. When they come out seeing well, with no pain and very little inconvenience, they're very happy. Also, we generally do the worst eye first. So when the bad eye all of a sudden becomes the much better eye and they realize how much vision they were missing even with the good eye, most of our patients are just thrilled and cannot wait to have the second eye done.
What about somebody who's trying a specialty lens for the first time? What can you say to them?
I try to keep the lens as simple as possible. So in all honesty, I don't think a specialty lens patient is going to have that much of a different experience than a patient with regular contact lenses, except for they may not have seen very well in a particular eye or both eyes for a long time. And when they get their specialty lenses and we place them on, they're generally much happier because they're seeing much better than they have many times for years. All the doctors here, not only are they excellent doctors, but they're good people. We care about the patients. We really want them to enjoy their experience here. We want to deliver the very best care that we can for them, and we strive very hard to make sure that every patient has the very best outcome at every visit and that they walk out of here happy and seeing well.
What about your team here? What can you say about your techs and the front office staff?
We have a very, very good team here. We've worked very hard to make sure that we hire good, competent people, good, compassionate people, and I get many compliments daily on how well patients feel that they were taken care of here and how much everybody cared about their well-being.
Well, thank you so much, Dr. Ryczek.
It's been my pleasure.
I'm looking forward to our next appointment.
And I as well.